Welcome. Thank you for joining us for the Pre-Application Technical Assistance webinar for the Pilot Grants Program for the Collaborative Research Center for American Indian Health, also known as CRCAIH. My name is Danielle Kenyon, and I'm the Program Director for CRCAIH in the Administrative Division. One of the roles of the Administrative Division is to run the Pilot Grants Program, and I'm happy to report this is our 4th cycle of funding. Feel free to browse the website to see what projects were funded in the past. This presentation will be recorded for future use and will be housed on our website at www.crcaih.org on the Training and Resources pages. If you have any questions or have any audio problems, please email the info@crcaih.org. We will have everyone on mute, or please mute your line if you're listening through your computer until the question and answer period. You can type in a question in the question boxes at any time. We will break for questions during the middle and the end. As I said, my name is Danielle Kenyon, and joining me today from the Grants Office is Rhonda Hinch. She's the Grants Coordinator for the Sanford Research Grants Office and will be doing the second part of our presentation. So to first go over the purpose of the Pilot Grants program, we have 3 overarching goals. We want to fund programs that are cutting-edge transdisciplinary research that will lead to reducing the significant health disparities experienced by American Indians in South Dakota, North Dakota, and Minnesota. So transdisciplinary is really the creation of multidisciplinary teams, people coming together from different expertises and approaching a problem in a new way. Projects will also embrace a social determinants of health theme, leading to the improvement of American Indian health. So social determinants of health are really the external environmental indicators that can lead to health behavior changes. And thirdly, projects should have the strong potential for future funding, and successful grantees in the past have shown a strong sustainability and growth of the project. So they've addressed these in looking and talking about how they will use this pilot grant data to apply for future research. So these are pictures of the RFA on the left and the Word document application form on the right that you will type your responses in. I'm sure many of you have visited the website and downloaded these documents needed to successfully apply. These materials have been distributed to over 600 contacts, including tribal health organizations, academic grant offices, and tribal leadership. So there's other resources on the website to check out as well, such as the checklist to make sure you have all the pieces for your application, as well as the frequently asked questions that we've developed from the past 3 cycles. So questions on the FAQs that we may not get to today, you might want to check out include questions on approvals needed, eligibility for principal investigators, and on budgets. So just to go over eligibility, the organizations eligible are really open as long as the organization is available to receive federal funding. So this includes being in good financial standing, having a DUNS number, and any applicants, so principal investigators, people don't have to have any specific degree. It can be any individual with the skills, knowledge, and resources necessary that you're arguing can carry out the proposed research. So investigators can participate in more than one application per cycle, but cannot submit more than one as the PI. And principal investigators who have an active CRCAIH award, such as one of our big research projects or the pilot grants from last year, are not eligible to apply. So this means that the principal investigator doesn't necessarily have to be a PhD holder, as long as they can make the case that you are able to carry out the project. A lot of our successful programs in the past have had multiple PIs, where an academic partner would partner with a tribal organization or vice versa, as long as you have that right collaborative team. So on our project timeline for this 4th cycle, our letters of intent were due December 15th, but if you didn't submit one, that's totally fine. But we would encourage you to call or email and connect with someone to see how we have CRCA services that can assist you in putting together the best application that you can. Our application deadline is the big one right there in red, is February 1st, 2016, so in less than a month now, these are due to our grants office. The notification of awards will be approximately sometime in April of this year, and the funding period that you will write for starts August 1st of this year to July 31st of next year. So we're looking at 1-year pilot grants. And we have about $240,000 to invest in pilot grants in direct costs for this cycle. What we would like you to write your project for is a project that is between $25,000 and $80,000 in direct costs, and we do allow full indirect costs at the rate that your institution has been negotiated at. So we anticipate that we would fund about 3 to 5 pilot grants this year. Last year we funded 3, and the 2 years prior we funded 5. A note on our tribal health research priorities. Over the last year, our Community Engagement and Innovation Division worked with our 5 tribal partners, who are now 6, to ascertain the tribal research priorities through a variety of methods, and they got community members' opinions on areas of concern and areas they would like researchers to look into for their tribe. So those categories are health and lifestyle. So some example projects are lifestyle changes, looking at overall prevention or delaying the onset of some diseases. The next category is health conditions, so examining the efficacy of existing programs, looking at different health outcomes such as diabetes, cardiovascular outcomes, obesity, cancer. And then the third is substance use and abuse, and looking at efficacy of approaches to reduce either opioid uses, prescription drug, tobacco use, alcohol use, looking at the efficacy of culturally based programs. And you can find more information and examples on page 3 of the RFA. These are really broad categories. They're not, if your topic doesn't fit in one of these, again, that's completely fine. It's not connected to any of the scoring criteria, but it would fit under whether it fits CRCA's priorities. So on the evaluation of the proposals, we have an external review process, and we have a great team of reviewers, of people that are from outside the North Dakota, South Dakota, and Minnesota region. All of these are researchers focused on a minority health, and over half of them focus on American Indian health. They are very experienced. We've had multiple reviewers that have been with us through this whole, all 3 cycles. So we're glad we have a great group of reviewers. So the topics that they'll be scored on is, like I had said, is that your topic relevant to the scope of CRCA? So going back to that, one of the first slides I put up on, we'll be funding cutting-edge transdisciplinary research that embraces a social determinants of health theme leading to the improvement of American Indian health. And then it has strong potential for future funding and sustainability. The second one is if the scope is reasonable and based on solid scientific methodology and includes an effective plan for meeting the objectives. So this is the research design component that's very important, and this section is where people commonly lose points. So this is your project going to be accomplished in a year? Are you measuring things in the appropriate way? Do you have a significant sample size for your pilot grant? The third criteria is if it's innovative with a strong potential for future funding. And so I would talk about this in terms of how you're collecting this smaller pilot data and how that will springboard into future projects and funding, how you are filling holes in the literature, and how your research is unique. The fourth one is are you using an effective use of the requested resources, and do you have a high likelihood of success in the environment? So this is where the reviewers will look at your budget, look at the your investigative team that you've put together, the facilities, and partners. And then the last one, criteria, is if the project meets a high standard of community-based participatory research or tribal participatory research and has a high level of commitment from all partners. So this is really, the reviewers are looking, does this project read as a true partnership and buy-in from all parties? As I had mentioned previously, we do have different division and core resources available to you to put together a strong application. And we do have a webinar of these resources linked from our pilot grants page. We have individual contact information for these different folks on page 5 of the RFA, and writing resources also on the last page of the RFA. So for the administrative division, let's say you had a question on the scope of the project. Are the aims too big? Is it too limited? You would reach out to talk about if the topic area fit, if the timing of the project fits. So let's say the project would start in August, planning for data collection December through March. Would you have enough time for analyses? We're happy to answer questions about the specific aims or different evaluation techniques. So a lot of times if you will call or email the general CRCA information line, it'll transfer to me or someone else at the administrative division to kind of sort out these bigger level questions. So for the community engagement and innovation division, you would reach out to them if you want advice or help in making connections with the tribal partner or suggestions on how best to apply community-based participatory research. You could ask them questions about culturally appropriate measures and approaches to working with different partners. So the director of that is Dr. Victoria Grayowl, and again, the contact information is listed in the RFA. The methodology core is another core that a lot of people reach out to in this stage of the pilot grants process. You could reach out to them if you have questions on your methodology of your project, if you have questions on what statistics to use, if you need help with the power analysis. They also have a webinar online if you're interested. And the director of that core is Dr. Susan Pumala. And then the regulatory knowledge core, they would be helpful to you at this point if you had any questions filling out section 7 of the application on human subjects, any questions on which institutional review boards you would need to use, what organizations to approach for different tribal review processes. A lot of times grantees work with them more after they receive notice of the funding. And the director of that is Jyoti Angal. So again, please reach out if you're not sure who best to go to for your questions. Feel free to use the info@crca.org or call 605-312-6232. So at that point, we will pause and see as I turn over the reins to Rhonda Hinch.
Okay, my name is Rhonda Hinch. I am the Sanford Research Office Grants Coordinator. I'm the primary contact for the coordinator for the CRCA pilot program. I'm going to provide an overview on the grant application, and we'll answer all the questions after the overview. So let's get started. On page 6 of the RFA, the formatting requirements are stated there. We follow the federal guidelines. On the cover page of the proposal, the title must not exceed 200 characters, and that includes including spaces between the words and the punctuation. And then you need to check mark whether this is a new application or a revised one. And be sure to include the last date it was submitted. Application organization. The legal address information is required, including the DUNS and EIN number. Failure to provide this information could result in your application being triaged. If you do not know your DUNS or ERN number, you can contact your finance or business office within your institutional or tribal community. Authorized organizational representative or sign official. This is the person with the signature authority to sign for grant applications for your institution. The principal investigator is the project leader who is the primary person responsible for the administrative, fiscal, and scientific conduct of your project. A co-principal investigator, this is optional, but if you use it when there is more than one investigator who is responsible for the administrative, fiscal, and scientific conduct of the project. Site locations. You need to complete the address, including the zip plus the 4 last zip codes and the DUNS number, and we need it for each and every site that will be participating in the project. There is a link provided for you to look up what your zip plus 4 zip code is. Authorized signatures. The principal investigator and the authorized organizational representative or signing official for your institution must sign and date the appropriate boxes on the cover page. Project abstract. You must state the broad and long-term objectives and specific aims. Make sure to reference the impact on American Indian health. Do not exceed 500 words. Project narrative. Provide a brief overview and describe relevance of the project to the public health. The narrative is made public for all awarded grants by both Sanford and the National Institute of Health. This does not usually exceed, usually is around 3 to 5 sentences. Biographical sketches. This was changed last year. It must be provided for all key personnel, and it is optional for significant contributors. The bio sketch is now in a 5-page format, and it includes education, a personal statement, positions and honors, contribution to science, and research support. And instructions and a link to the current form are available on page 7 and 8 of the RFA. Bio sketches do not exceed 5 pages per person, and the bio sketches should be included in Appendix A of your application.
Great. And just a little bit more detail on the bio sketches, since there's a new format that some people may not be used to. As Rhonda's mentioned, this has changed in the last year since we did the pilot grants previously. And so just going over this a little bit more in detail, one of the big things on A that NIH has had for the last few years is this personal statement part that we can, this is where you really put your personal statement describing where you're well suited for your role in the project described in the application. So relevant factors may be like your training, your previous research work, your collaborations, the environment, your past performance. So because a lot of your work is collaborative, you can talk about your team's experience. And then below this section, so I've got my example personal statement above, is where you can put up to 4 different peer-reviewed publications that specifically highlight your experience for this project. And if you wish to explain different impediments towards your past productivity, you can do that, describe different factors there as well. And it's really important that these personal statements are tailored for different applications. So mine look very different if I'm applying for a training grant and doing education or mentorship versus a research grant or mentoring somebody else. So the one that's shown as an example is more of evaluation and curriculum development. So that's a very important part to use and show why you're the right investigator to be funded. And then this section, this example, contributions to science, is the newest part to the bio sketch. And this is where you summarize your accomplishments at a higher level of what are your contributions to science. So for collaborators with less research experience, this can be a nice chance to highlight their expertise in different ways. So what you do here is, and you see the example that I posted is just one of the up to 5 that you can list. The significant contribution to science. You can talk about the historical background that it frames the scientific problem, the findings, what influence you've had on the field. You can reference, again, up to 4 peer-reviewed publications underneath your little paragraph describing that. You can talk about different approaches that you've made to the contribution. The description of each contribution should be no longer than a half a page, including figures and citations. You can also provide a URL to list your full published work as found in a publicly available digital database such as SciEnvironment or My Bibliography, which are through the National Library of Medicine. So if you have questions on that, please reach out to our grants office and they can talk you through how to update your bibliography. So the approach that I would take to this is look at your past publications or past research work and see how you could categorize them into different ways. So think about how you make sense of your path in research. And many of us are junior investigators, so we're not going to have 5 different contributions, so that's completely fine. But just think of how you would group some of your research and approaches. So for example, when I've put this together, I've talked about like the theory or strength-based approach that I use, the different target populations that I work with in working with diverse groups of youth, areas that I've worked a lot in, like such as my dissertation, or different types of research methodology, qualitative, quantitative, that I've used. So there's lots of different ways. There's no one right way to go about approaching this section to the bio sketch.
The facilities, equipment, and other resource section, you need to identify the facilities to be used and what equipment is available for the project. If multiple site locations are being used for your project, please describe what resources are available at each site. Discuss ways the environment or subject populations will work together to form collaborative arrangements. And there is no page limit for this section, so have at her. Research strategy. It's made up of 4 different sections. Be sure to use the appropriate section headings: specific aims, significance, innovation, and approach. The sections A through D are limited to a total of 6 pages. And the specific aims page is not to exceed 1 page. So, and instructions for the specific aims and the rest of the research strategy are on pages 8 to 9 of the RFA. Citations. Our relevant works should be cited in this section. However, the full reference should be provided in the references cited section, and they are not included in the page limit. Tips on writing the content of your pilot grant application. Please reach out to the cores and divisions to discuss the scope and design of your project, particularly the methodology and administrative divisions. There's also tips at the CRCAIH website on writing applications and resources. Again, reference and cite it. It's part of the research strategy. Each reference must include names of all authors, the article title, journal or book title, volume number, page number, and year of publication. And the references are not included again in that 6-page limit for the research plan. It's an unlimited amount. Human subjects. All research projects involving human subjects must complete sections A through F. This section is required for the majority of the pilot grant applications. Additional information and link detailing the requirements for each section is provided on page 9 and 10 of the RFA. A planned enrollment form must be completed in its entirety. There is no limit for this section, and the age of a child changed from 21 to age 18. This notice was sent from NIH on October 31st of 15. What changes on the notice were stating the application's proposal submitted for, any application that is submitted after January 25th of 16 for the purposes of an inclusion policy, the age of a child will be defined as individuals under 18 years old instead of under 21 years old, and the current NIH definition of a child for inclusion policy considerations. So the consideration of a child as a vulnerable population for human subject protections from research risk and the NIH child inclusion policy are also convoluted. While these are distinct policies, many think that children as under age 8 years of 18, typically the age of consent. That's why it was changed. If you have any questions on this or need further information, please contact the grants office. Institutional Review Board. Projects involving human subjects will be required to have IRB approval. This approval is required prior to the start of the project. If you have IRB approval, please include the approval letter in Appendix C. If approvals for other IRBs have been obtained, include them as well. Please copy, paste, and complete the sections in Section C for complete the questions in Section C for each IRB involved. There may be more than one depending on where your project is located. If you have any questions regarding IRB, please contact the Regulatory Knowledge Corps. A common question we get used on IRB is, for example, if you're not working any tribal nations, no additional tribal review board to your institution. Often a simple question depends on where you are collecting your data. If tribal research review boards are set up, if the tribe has designated the Great Plains or Bemidji Area Indian Health Service to conduct the review. So it'll depend on what you're working on what tribal review board you might need to get approval from. Tribal approvals. Each tribe as a sovereign nation has their own process of approval, and any other tribal approvals need to be received before the final notice of award can be issued. Appropriate tribal approvals, which could also include the Tribal Council resolution, is required prior to the start of the project. Official award letters will not be released until the appropriate approvals are in place and approved by Sanford Research and the NIH. If any approvals have been obtained, again, include those in Appendix C. Upon award, organizations will be required to work with the Regulatory Knowledge Corps to ensure all appropriate approvals are in place prior to the start of the project. Again, we encourage you to reach out to the Regulatory Knowledge Corps. Oftentimes, approvals are an involved process. Multiple principal investigator leadership plans. Applications designating multiple PIs must complete this section. We must provide a rationale for choosing a multiple PI approach, describe the governance and organization structure of the leadership team, delineate the roles and administrative, technical, and scientific responsibilities for the project. Additional instructions are available on page 10 of the RFA. There is no page limit for this section. We have many questions sometimes regarding the titles of the personnel. A principal investigator, she is a project leader with scientific, fiscal, and administrative responsibility. When you have multiple principal investigators, in some cases, particularly with multiple site projects, more than one individual is considered as responsible for administrative, fiscal, and scientific conduct of the project. If you're using this approach, each person should be named in the proposal and on the project and documented as a PI. Co-investigators. In some cases, several individuals conduct the scientific portion of the project. One of these individuals is named the PI, while the others are investigators, will be considered co-investigators because they're just assisting the primary. Consortium contractual arrangements. You need to explain the programmatic, fiscal, and administrative arrangements to be made between your organization and the consortium organization. If you have a consortium or a contractual agreements, please include them in Appendix B. There is no page limit for this section. More details are available regarding the instructions on page 11 of the RFA. Letters of support are mandatory from collaborating organizations. These letters should outline their commitment to this project, to your project, and not just general support of the project. For consultants, please have them include a rate or a charge for consultant services in their letters. All of these letters need to be put in Appendix B. There is no limit to the number of letters that you may include, and more detailed instructions are available on page 11 of the RFA. Resource sharing plan and data management plan. You need to provide a detailed explanation on how the data will be collected, analyzed, and interpreted, and provide a brief one-paragraph description of how final research data will be shared, or explain why the data sharing is not possible. There is no page limit for this section. Budget. The budget period for this cycle is August 1st of 16 through July 31st of 2017. The applications with total direct costs between $25,000 and $80,000 will be considered. This does not include the applicant's organization's indirect costs. The budget and the budget justification. We are using the PHS 398 form to complete the budget section. You must include all, under personnel, you must include all personnel involved in the project, including the amount of time they are dedicating to the project and the amount requesting. Include all personnel regardless of whether or not funding is being requested. Many people are forgetting to identify the effort for their staff. If funding is not requested, you just put a 0 under salary requested. Materials and supplies. Examples are office supplies, postage, communication, lab or medical supplies. Computers are allowable only if they are to be used 100% for your project. Travel. Examples include travel to Native American communities, project meetings and training. Travel to national meetings is not allowed. Travel to the annual CRCAIH Summit is limited to $1,000 per proposal, inclusive of all the prime and all the subs. You cannot request $1,000 per entity. inpatient, outpatient care costs, unpaid research costs of a project for inpatients, such as lab tests, x-rays, imaging, not considered as standard of care, can be budgeted. Alternations and renovations, these are allowable costs in this, are not allowable in the CRCA grant. Other expenses, you must list any expenses not detailed above in this category. Examples may include food for focus groups, community advisors, participant incentives. Publication costs are not allowed. Direct and indirect consortium or contractual costs, insert that the total direct and indirect costs for these entities in that line item. On the budget justification, you must provide a detailed budget justification for all costs. Be sure to identify the role of each person involved in the project. Provide a brief statement of work for each consortium or contractual arrangement. A detailed budget is required in question 13. And there is no limit to the page limit to this section. And if you have any questions on this, please contact the grant office. I'd be more than willing to help to review budgets, justifications prior to submission. F&A costs. F&A costs are allowed at the applicant's institution's approved negotiated rate. If requesting an F&A costs, or another word for indirect costs, the appropriate section in the application package must be completed. If you do not know your institutional indirect rate, please contact your institution's grants or business office. Institutions that do not have an indirect F&A rate can request 10% indirect costs per NIH guidelines. Contractual consortium budgets and budget justifications. You must complete the budget in the application package and provide a detailed budget justification with respect to the proposed project for each consortium and contractual arrangement. Each contractual consortium arrangement must have their own budget and justification pages. Just copy and paste the budget and the justification pages and add it to the application. Contractual and consortium direct and F&A indirect costs must be included in the total direct costs of the submitting institution. So if you're working with consortiums on your project, your total direct costs must include their total direct costs and the indirect costs of the consortiums. There is no page limit for this section, and more details on this are available on page 11 of the RFA. Appendix. Again, Appendix A, that's where you will insert your biographical sketches for all your key personnel or significant contributors. Appendix B will be your contractual consortium arrangements, your letters of support, and that includes your tribal partner letters or resolutions. Appendix C can be publications, surveys, questionnaires, other data collection instruments, clinical protocols, informed consents, IRB approvals, and tribal approvals. The application submission must be received by the Sanford Research Grants Office no later than 5 p.m. Central Standard Time on February 1st, 2016. And I will send out an email confirmation when I receive your application.
Great. So as we're just wrapping up, I want to encourage people to type in any questions you have in the question boxes, and we'll unmute everybody's line, I believe, or unmute it yourself. or please type in the question box. So as we're waiting for questions, and again, type those in. I don't know if we're able to work with the audio at this time. So if you could please type in your questions in those boxes, we will get to those and during this question and answer period. And as we wait for questions, I just want to underscore a couple things that Rhonda said. She is really great at reviewing budgets, any budget line items, budget justification things. If people get their grants in ahead of time, she's able and has time, she's able to look at those. Or I just encourage you to reach out to her and her office as early as possible to get that sort of help. And encouraging you to reach out to the rest of the corps and divisions as soon as we can. This is one of the most fun parts of our job, is helping people with their pilot grants and helping you make it as strong a case as you can to fund your project idea. So the sooner that you reach out for assistance, the better. And I think everybody I talk to appreciates all the feedback and support that they get from the CRCA corps and divisions. So as soon as possible. So again, if you are interested in the Corps and Division resources, feel free to call that general CRCA office number. You'll reach Sarah at 605-312-6232 or email info@crca.org. Or if you have a grants office specific question, please call Rhonda. You will get her most likely at 605-312-6077 or email her directly at researchgrants@sanfordhealth.org. Do we have any questions yet? Our PowerPoint and presentation was so thorough with as many details. We keep packing in more and more details every year. So hopefully that means that we've covered all of your questions, or you've reached out and already received help with your questions. I know that there's quite a few people on the webinar that we haven't talked to yet, or at least I haven't talked to. So I'd really encourage you to reach out for any assistance or any questions that you might have. So yes, I'm seeing a signal that we have a question.
Question is, what division is best to reach out to when there's a question of PI, co-PI, or co-investigator?
I think that would probably be a good question for myself, the administrative division. So I think we have our contact. My email is danielle.kenyon@sanfordhealth.org. So DENYELLE.KENYON@sanfordhealth.org, or just feel free to email info@crca.org, and we'll get it to the right person. But that usually goes to myself or the overall PI, Amy Elliott. Wonderful. All right. Well, we'll just pause for another moment and just thank you for all of your time and attention and in being interested in the CRCA pilot grants. This is our 4th cycle, and we're not sure if we're going to have a cycle next year. That would be outside of our budget period. So this may be the last one for a while. So I know I've been encouraging people, if they're on the fence, to definitely apply this year. And we're just so happy to offer this and offer this opportunity for those of you working in American Indian Health.
All right, we've got another question in. If you're proposing a study that's embedded within another study, do you have tips for delineating the two projects? Is this something that's been done before within the CRCA pilot grant program?
I think people have done this, but it's been more external to the project, like they're just working with the same sample, so it hasn't gotten too complicated, I guess. So if there's the most simple way that you could do it, overviewing the larger project in a succinct way, and then just describing maybe some of the background, because that would be a strength on the design of the project, whether you're using like their participants or the sample or the overall structure. So I guess touching base on the things and that they have set up that you would be using, and then moving forward and talking about your project as an add-on. So I don't know if that's clear. You'd probably want to do it throughout, but really highlighting how the design and what is set up in the bigger project can help feed into and how you're using that in your pilot grant.
Another question in, what format do you want the references submitted?
There's no format that's specified, so the reviewers will take any format, whether you use APA, the medical, anything, just keep it consistent. All right. Well, good. Thank you so much for your questions. I know they will help others, and if that didn't answer your question to the fullest, please reach out, and we are happy to talk with you further. And we look forward to receiving your grants before February 1st at 5 o'clock Central Time. Thank you so much.